TB infection, so I'm using the term infection. Infection, there's a difference between infection and disease, right? So TB infection, there are reports that could be up to 80% of adult population, especially of the African origins, have been infected with TB. It's possible that me and you probably have been infected. This does not mean we have the disease. It means that we have been exposed or at some point in our life, we have inhaled this bacilli. But because it's a very good bacilli or bacteria, it's able to stay in our lungs in a capsule that does not evoke or does not an immune response. Your body will not see it or will not see it, so it will just remain there dormant. But if conditions changes, then it will cause a disease. Those are the people that you need. When it's in a dormant state, we call it latent TB. There's very little interventions you can make for this patient, because just as much as your immunity, there's no access to this bacilli, you may also not reach it with the drugs. So you can't sort of like treat it in that state. Yeah, you can treat it, however, if the person now start being sick. Now this is in the disease state. But the good thing about TB, it's very it's treatable, right? So if you are diagnosed on time, we have the ministry has a cocktail of drugs, right, that they would give you. Yeah, and then these drugs, if they are taken correctly, you will be able to make 100% recovery and to complete the course, and you'll be treated. Yeah. But complications do happen though. For example, mostly it's complicated with inadherence. If you give the patient this cocktail of drugs and they don't take them, or they don't take them as they're supposed to, they may develop what we call resistance.
Okay.
Yeah, so this would require now even much more stronger drugs, which can cause now even further complications, like your liver can be damaged. Sometimes there was a drug in the past which it's now been they're limited use now, but there used to be one of the TB drugs that caused hearing losses. Yes, so yeah, so it's treatable, but there can be unintended consequences, such as developing resistance or getting other conditions, liver disease, sometimes hearing loss. Yeah, but it can be treated. It's treated, and the good thing I should mention is that Namibia in the last year have reported a 90% treatment success rate, which is very good considering our high TB burden. Yeah, and you want to be able to treat the patient completely so that when they go out there, they do not further spread the disease.